Dr. Al Scherzer is past president of the Academy from 1985 to 1986. His membership and contributions to the Academy spans 55 years and have included chairmanship of the International Affairs and Advocacy committees. He has served as editor of the Professional Parent Reading List and most recently served 10 years as the Academy's historian. In 2011, he received the Academy's Lifetime Achievement Award. A passionate developmental pediatrician, researcher, and health educator, Dr. Scherzer's extensive career spans the globe, and his contributions to the field have influenced both the training of countless medical professionals and have touched the lives of children and families from all walks of life. He currently lives in Ormond Beach, Florida, with his wife Debbie, where he enjoys birding after many years of great activity in eastern Long Island. Welcome, Dr. Scherzer, and thank you for being a part of this past presidential tribute.
Jen, thank you so much for that very kind invitation. I really want to first thank the Academy for this project, which had been discussed many times in the past. It's an opportunity for past presidents to share their experience and insights, which I think ultimately is only going to further strengthen the organization we hold so dearly. I should start by saying that it took me 10 years to go from college to the end of college to medical school. And during that period, which turned out to be extremely fruitful, I served mostly in international public health education work in Southeast Asia and the South Pacific. And it's something that became part of my heart and soul and was professionally and personally important for me for the rest of my life. But when I got to medical school, the question is, what was I going to do with it? I mean, I actually wasn't entirely sure. I knew I had to be a physician, but how and what was not clear. By the end of medical school, clearly it was pediatrics, but even then it was unclear. And until I had a rotation as a resident through the cerebral palsy clinic at the Hospital for Special Surgery. And there I met Dr. William Cooper, an old line orthopedist who really was more likely to prescribe social service, social work than surgery. And incidentally, there were two orthopedic fellows who I became friendly with, and we continued to have lifelong contact through the Academy. And that was Dr. Rosenthal and Dr. Root, both of whom have passed on, but were very adhered to this Academy. Well, through Dr. Cooper, he was clearly the start of what was going to be my career in this field. The primary mentor was, of course, Dr. Bill Cooper, who was the director of the CP clinic at HSS. And I watched him, I observed him, not only with patients, but with parents and family. He had them all gathered when he saw a child and really questioned all of them very carefully. And it just showed me something that I hadn't really appreciated, even as a medical student, the importance of a family in this kind of a setting. And so he really got me started in the right road. And soon after, when I finished my residency, I was appointed to the faculty at Cornell, and through Dr. Cooper, assigned to the Cerebral Palsy Clinic in Nassau County, a part of Long Island, where he had been the medical director for some time. So it was a very close connection with Cornell, but it was still through my contact with Dr. Cooper. And that was in 1966. And I had heard that there was a training program available in Chicago. I inquired about it, and through Dr. Cooper, was able to attend the training program in pediatric neuromuscular disease at the Cook County Graduate School of Medicine in Chicago. The director was Dr. Meyer Pearlstein, a remarkable guy. At the time, I really didn't totally appreciate who and what he was. Of course, as we all know, he was one of the 6 founders of the Academy. So I'm really the breach between today's world and those old days when the Academy started. And Pearlstein, while supposedly a neurologist, was of course self-trained. And for many years, he, in the spring, he'd get in his car with a brace maker and a bunch of braces and do a northern tour through the small towns in upper Wisconsin and Illinois, looking for kids who had problems with motor ability, obviously who had mostly cerebral palsy. And over the years, he accumulated some 10,000 of these cases, which then became the basis for this course, which he gave in Chicago every year for 2 weeks.
Wow.
It was a heck of an experience.
Wow.
And I came away feeling that this is really going to be my field. So subsequently, by the way, Pearlstein became associated with me. He helped me develop a one-day training program at my CP Center in Long Island, a first time ever, and brought with him Dr. Richmond Payne, a very well-known neurologist from Washington, D.C. So this was a heck of a start to a beginning career in the field.
Amazing, amazing. Can you tell me about that first meeting with the American Academy for Cerebral Palsy and Developmental Medicine that you attended in 1966?
Well, actually, again, 1966 was a very special year for me, and because the annual meeting that year was being held in New Orleans, and as it turns out, it was a very special meeting. Again, Dr. Cooper urged me and supported my going to that meeting. This is the famous meeting on systems of therapy. And it was very historic because it was only after World War II that we began the concept of rehabilitation medicine began to come in to the field, and it moved very rapidly. Quickly, numerous types of therapy for kids with cerebral palsy emerged. Some of them had a physiologic basis, others didn't, and all claimed on the basis of anecdotal information rather than any data that theirs was superior. So by 1966, there was a whole field of these schools of therapy vying with each other for top status and making the difference in children with CP. It was a wild meeting. I mean, it was just presenters working to show what they could do, and being, in a way, able to demonstrate what they had, but of course, without any data. And the controversy was around a number of them. One of them was referred to as the Doman-Delicato method of helping a child by being in a prone position, using his arms and legs, and ultimately, supposedly, getting up and able to walk. Very controversial, and one in which later it had a great effect on the Academy. Dr. Pearlstein was among those who strongly worked against this, was able to get a committee going, an ad hoc committee of the Academy, which would prepare a report which ultimately was published. And the secretary of that committee was a psychiatrist who was sued by the Doman-Delicato group. And unfortunately, for some years, the Academy was stuck with paying his legal fees. So it was not a happy outcome, but it brought a lot of light to what was really going on and what was possibly useful. But aside from that, the Academy opened up something to me which I was totally unaware of. Remember, the only training I had in this field was a few months at the cerebral palsy clinic with Dr. Cooper. I had no other training.
Yeah.
And all of a sudden, I discovered instructional courses at the annual meeting. And that really grabbed me. And from then on, I never, ever missed a meeting, always went to the instructional courses, which ultimately became my special training. Otherwise, it was basically by the seat of my pants that I was doing it. But also there were very important relationships that developed even at that first meeting. Me as a complete neophyte would be standing next to some well-known professor in the field on a completely equal basis, sharing our experiences at the meeting. And there was no question about rank or maturity. And of course, that only continued as I got to know more and more people. And also following that meeting, of course, I immediately applied for membership status. And at that time, though I was an MD, I did not have my boards. And as a result, my status was of an associate member. And that's what the category was at that time. No one could become a member unless he was board certified as a physician. Those were the only people who were allowed to be members. Remember, the Academy started with board certified people. There was to be 100 of them total, which quickly changed, but it took a long time before there were ultimately everybody could become a full member. In fact, this was now 1966. It took until 1993, almost 50 years before therapists, anyone with qualifications could become a member of the Academy. And incidentally, it was right after that happened that the Academy membership reached a level never seen since.
Wow. Can you tell me some of the highlights from your presidential year?
Well, 20 years later, somehow, I became president. 20 years later, in 1986. And not surprisingly, my theme was cerebral palsy as a major public health problem. No surprise there, right? I had maintained my contacts overseas. I had enlarged my ability to deal with international issues in this field. And so that was an important part of the meeting. What the president did at that time is something that I think I just need to mention. This was before we had a presidential line organization, which we have now, where the second and first vice president move up and ultimately become the president. Then there was just the president. There was no vice president. And the president did it all. In his year, organized the meeting, got everything going with all of the instructional courses, made the assignments to committees, all in 1 year. And I really think now as I see how the Division of Labor, how much better it works, I just wonder how the heck I did it. One of the things that I remember very well from this time is shuffling around cards to see the numbers of people who said they might be interested in a committee who had not yet been assigned. And I just sort of pushed around and I thought, oh, well, let's make a good geographical distribution. So I pulled out a card from Iowa, of all things, where there wasn't that much representation. And that person who I assigned to a committee later became a president of the Academy. That was Dennis Harper, was a PhD psychologist. The meeting itself, my hope was that it would be truly interdisciplinary. And I really mixed things up so that orthopedics and pediatrics and rehab kind of were intermingled in sessions. It was not met with, I think, a great deal of appreciation. They weren't single orthopedic sessions as such as we have today, etc. So there was some discomfort expressed with that, although I think we did cover a great deal of interdisciplinary awareness that may not have existed to the same extent.
So are you able to share some of your most embarrassing presidential moments?
Well, just building on what I had said about interdisciplinary activities and the quest to try to do that, I discovered suddenly that someone had taken over one of the meeting rooms without any knowledge, and the room was filled, all with surgeons, orthopedists, and it was Dr. W. Peacock from South Africa who was bursting with enthusiasm to demonstrate the new procedure of selective dorsal rhizotomy. And he just decided to come to the meeting and do it. So we had some very large words, and perhaps there were many people who got something from his session. I really don't recall offhand how much he was able to actually present after I got on the scene. It was not pleasant.
In all of your experience with the Academy, what are you most proud of?
Well, first and foremost, of course, I was able to initiate the International Affairs Committee. And, that just flows from all my background, all my time. And at my meeting itself, by the way, there was a heavy theme on the international aspects of care for children with disabilities. And it's one of the interesting things I think that might have been forgotten. Right after my presidential year, we organized an international meeting on childhood disability in the developing world, which we got the Spastic Society in England to sponsor for us at a very beautiful place, the Castle Priory College. And at that meeting, there were people basically from all over the world, and some Academy members who were part of that committee came. Al Healy, who's now gone, came from Ireland, where he was on a fellowship, and Dr. Butler came from a world tour to be part of that. And that meeting was heavily supported by the Spastic Society and the Red Journal. It was a first of its kind to have a meeting actually outside of the country. But in a way, as I look at it now, I think the numbers of people from all over the world now who are part of the Academy and what has happened, certainly that International Affairs Committee and its activity, I think, had a bearing on that, and I think to a certain extent on the development of the AACPDM, which I think obviously is a future.
That was going to be my follow-up question, was that the impetus for the AACPDM?
Yeah.
Okay.
Another aspect which I think was important to me was developing the Advocacy Committee. I had mentioned earlier that there was controversy over the Doma Delicato procedure, heavily denounced everywhere. And as a result of the suit, there was much feeling within the academy that we really shouldn't get involved in advocacy activities. Especially the most senior members said, that's not our job. We shouldn't be pushing anything. This is a professional education organization. That's what we should do, and nothing else. We can have meetings, etc. So there was great opposition to any kind of advocacy. Yes.
May I ask, was it because they were afraid that if they put their name behind something, it would subject them to some sort of, I don't know, further lawsuits, or why were they afraid to advocate for anything?
Well, I think it was certainly that, in part. I mean, financially, it was a very, very serious problem for the academy for a number of years, until ultimately the suit was just dropped. It just wasn't pursued by Dome and Delicato. Mm-hmm. But I think also some people felt that this was draining our resources mm-hmm. from our educational effort, and we shouldn't do it. And the issue of making people aware of the academy and CP was very secondary to many. So the idea of an advocacy committee was very much opposed in many respects, until Dr. Jeff McLaughlin, present day after me, came up the idea, and he asked me if I would see what I could do to try to get this thing organized. And we were able to get it through. And from that emerged what we know today as the Family Forum. And so, those efforts, it took a long time to get that to be really developed. The next one, which I really feel very strongly about, is the Community Council. And here again, it was a collaboration, very much started by Dr. Joe Dukowski. I was involved with him. That is, as you know, now part of the structure of the academy. A new bylaw change has made that happen. And the hope is that it will bring in people who have interest in the field, organizations, families, and even people with cerebral palsy who can in some way directly involved. And that is still evolving, and incidentally, through the Family Forum is actually now part of the Community Council. So it's moved away around a little bit. Another thing I feel very positive about, somewhere around 1980, Dr. Len Bender, a rehabilitationist, and his wife, Nan, an occupational therapist, got the idea of having an exhibit of books at the annual meeting. And so they basically lugged, I don't know how many, or shipped them to a booth that we had every year as the annual book fair. And the idea, it was not sponsored by any publishers. This was strictly Academy. And over a period of time, somehow or other, I got involved, and we decided that there should be reading lists. And I took the reading list for professionals and then took it for parents. And it was quite popular. We had it published every year. It was a handout that went with the other materials from the, that went with the membership at the annual meeting. Somewhere along the line, the concept developed that if you buy a book that's on the recommended list and you buy it from Amazon, you would get a discount. And so that went on for a number of years. And I don't know that that was particularly well appreciated or aware, but more recently, that has been extended now so that anything you buy from Amazon, if you designate the Academy as a charity, they will receive a portion of that. And I just sent you yesterday, I think, just by happen chance, an accounting of that I received from Amazon. I don't know where that came from. So, you know, this started 40 years ago. And to this day, the Academy is one of the many charities to which Amazon is contributing. So that's not an advertisement or a plug, but just you should know that if you happen to be buying something and you designate the Academy, it will receive some kind of a contribution.
Yeah, through Amazon Smile.
Amazon Smile. And
I believe you've spent 10 years as the historian for the Academy, and I know that you've made incredible contributions to organizing the bylaws in particular. Could you tell us a little bit about your work as the historian?
Well, the historian was a very interesting position. I was absolutely delighted to take that on because it was a way for me to continue to be involved with the Academy. And it was a terrific opportunity. I learned a lot. We helped reorganize and develop the bylaws, which it's a bylaws is like it's a quicksand. You think that they've been brought up to date, etc. But it's constantly in need of changing. The other thing is that the activities of the board of directors and other committees need to be monitored carefully because people forget what was said previously, or it gets buried and we start all over again. That happens many times. So the historian has an important role in monitoring and remembering and being aware of what goes on and what the history is, and not to repeat things that have been done before, to be done in an appropriate manner, etc. But the other thing about the presidential, the historian position, it is a curious experience that every time, each year, each new change in president, as we sat in the front of that room where there was the line of presidents, presidential line, second, first, etc., president, I observed the second vice president and watched the change, the maturation over a period of time as I watched them each year. And not one came out without being significantly changed and matured. It's an amazing experience actually to observe which people are doing now. I think it was very positive, and I think we all learn things at many dimensions, not only the management of the Academy, but interpersonal relationships with other organizations. And at a time, of course, when things are changing, there's a lot of change going on that you have to adapt to.
Absolutely. So what is your vision for the Academy moving forward into the future?
Well, I'm very conscious of the fact that this is our 75th year. And during that time, the Academy has shifted from a so-called small specialized physicians discussion group to now an international forum for children with any kind of childhood onset disability around the world. Think about that. It's enormous. And I appreciate that because I saw so much of it, you know. So it tells me the nature of what kind of an organization, what we represent, and how we're in existence to an extent that perhaps you would not have predicted. And not only the organization, but the field has changed enormously. In my day, even dating from the old polio days, it was physical disabilities that were very largely what we dealt with, and that's what brought me into the field with CP. But it's now into the intellectual issues, behavioral issues, as you know, and combinations. There's no such single thing. There's no simple, this is it. That's the diagnosis. There isn't. And not only that, but what is the cause? Used to be simple. It was anoxia, or it was some specific, or infection. Today, we're much more aware that it's genomics, genetics, and we don't know where that's going, to what extent we're going to have to be humbled to all the things we used to say, that CP is absolutely not inherited, absolute, taught that all the time. We're changing, so we have to change with it, and we have to be aware of that. So it leads me to where we need to go. I feel very strongly in my own experience that the emphasis needs to be on very early identification, diagnosis, and intervention. But beyond that, intervention, what does that mean? I don't mean particularly a specific form of therapy in a building known as a CP clinic or a special clinic. I'm talking about the involvement of the family in the whole process. Something that way back I learned from my experience with Bill Cooper at the CP clinic. He brought the family in. He'd present the child, but the family was right there, and he talked with them. And I think that's what we need to understand and emphasize in the academy more and more and more. And I say that because I have had people, friends in WHO, for example, who've said to me, "What are you wasting your time with early identification? And for these kids, there's no services available. There's no therapy. There's no clinic." And my point is that there's a family. There's somebody who's taking care of that child. And we have to work with that family, not only to help them understand what's going on with attitudes, but also what they can physically do. I mean, how to feed them, how to dress them, how to toilet them. Early care and management will make a huge difference, and etc. But I don't think we've really explored that aspect to the extent that we can. I do have membership concerns. In 1993, the Academy was at about 1,600 after everybody became a member, no matter what your discipline. We haven't achieved that yet. And we have a lot of competition. I think, particularly in the United States, pediatricians who work with children with disabilities are either neurodevelopmental pediatricians or developmental behavioral pediatricians. That's not true in Canada, for example. There's no such thing. Here we have some special inner politics. We are not pulling in any of the developmental behavioral people, and we need to get out and get to them. And I think our unique model of what we represent, the future there, of course, is AACPDM. And that is something that we just need to build on and pursue. We need every resource we have to make that really meaningful. And finally, I would say, I think, heads up, prepare now for the centennial in 2046.
Thank you, Dr. Scherzer. This was an amazing interview. I hope everybody enjoys it as much as I have. And
well, I hear you. You helped me. They're very supportive, and it's not easy to go through all this stuff. You know, I need it. I know it like I know the back of my hand, but to try to put it across is another story.
You've done an amazing job. And I know you mentioned that you did want to thank the Academy. I
Yeah,
know you did at the beginning. Did you want to take this opportunity now? We can add it in, and if you
yeah,
wanted to.
I could do that. Um, I have strived as a child for reasons that maybe a psychiatrist would deal with, to become a physician. That's all that I ever wanted to do, is be a physician. And by the time I got to college, I had only a middling experience for many reasons I couldn't possibly go into now. But my quest for going to medical school was blocked, possibly through a number of reasons. At that time, 1949, it was, not long after World War II, believe it or not. And so there was a lot of competition. So I sought other ways of trying to see what I could do, always applying. And it just didn't happen. I got into public health. I did, as you know, got some graduate experience. And I just never, I never knew how I could find a way. It never left my mind. And many years later, I happened to be in Apia, Samoa, on an assignment for the World Health Organization with the South Pacific Commission. It was a frustrating trip I was on. I said, oh my God, politics, and it has nothing to do with it. And so I wrote a letter to the dean of the medical school at Columbia, where I had been rejected before. And he said, why don't you come and see me? And that's how it happened. But my point is, so then what was I going to do with it? And it was cerebral palsy that pulled me in. And it was it was the Academy that gave me the education and the feeling that this is a worthy cause to spend my life on. And I thank the Academy for that.